Good evening, everyone. Good evening. Welcome to ATP Live. I'm on the road. Hopefully, Dr. Rotimi will join and support me this evening. Let me know whether you can hear me and you can see me. Just drop a comment. Let me know. Just let me know whether you can see me and you can hear me. Let me see it in the comment section. All right. Thank you for letting me know you can see me. So please let me share the video. Let me share the link. My hands are quite tight, but I'll do my best. So welcome to ATV Live. If you have any questions about your children's health issues, please drop it in the comment section. I'm hoping Dr. Rotimi will join us and then we can manage. It's not yet here. All right. Thank you, thank you. I can see some of your comments. Please help me share the link. Just share the link, share the video. For our moderators to be watching, please help me to pin the link appropriately. I hope it's not too noisy from my background, but just manage it for now. All right. Thank you, Samantha. Thank you, Yancy. Thank you so much. I can read your comments. All right. So welcome to ATP Live. This is a section where you can ask any questions you have about your children's health issues, and we'll try and answer them in the next 1 hour. So please go ahead and drop your questions. Invite your friends, family. Apologies to those on Instagram because I'm using my phone and I can't go live simultaneously on my phone, on Facebook, and Instagram at the same time. So sorry, we'll be able to do Instagram live, but I will post the video to those on Instagram to watch later on. So you're welcome to ATP Live. If you have any questions about the health of your children, feel free to drop your questions in the comment box, and I will try and answer them in the next 1 hour. If you're watching on, obviously you're watching on our Facebook group or the page or YouTube, just drop your questions. I think somebody should help me share to the other group because I can't do that right now. All right. You're welcome. Welcome. So feel free to drop your questions. I'll start answering them as I see them. Right now, I can't see any questions, but I can see people are able to see me and able to uh, hear me. So that's good enough. Thank you. Welcome. Thank you. Again. Facebook is thank you, everyone. So drop your questions. I can't see any questions yet. So when I see questions, I'll start to answer them. All right. Okay. I think I have a question. And the question is, Welcome, doctor, what are the symptoms of mumps? Okay, and its solutions. All right. So mumps is a viral infection, and it's one of those viral infections that present with fever, rashes. But one of the things that makes mumps different is that it tends to cause swelling, usually swelling of the cheek. You're about to say shake a day or something like that. But when you see a child who is having fever and after a couple of days develop this swollen cheek, that is one of the earliest signs of mumps. But before the swollen cheek or sometimes the rashes, they tend to have high grade fever and then you will see the cheek. So That is the salivary gland actually that are swallowed, and that is very common. So most parents are able to recognize the child who has mumps, and it's a viral infection. And like most viral infections, you can't treat it. Okay, I think Dr. Rotimi is there now. So let me add him. Um, yeah. All right. So viral infection most of the time don't have any specific treatment. They just they run their course and then they go away. That's how most viral infection uh, um, happen. So yeah. So if your child is having mumps, what you need to do is to give them paracetamol. Uh, they have paracetamol, and then they can give them lots of fluid. And so just read the symptoms. Most are within a couple of days, so 9 days max, most of them will go away. All right. Thank you. Dr. Rotimi, you're welcome.
Good evening, Dr. Gbemi. Good evening to all our members and our followers. Happy New Week and happy ATP Live.
Okay, Dr. Rotimi, can you help us to share the video to the ATP family and all the other pages if you can? Help us to pin it because my hands are too full. So I will leave it to you,
Okay.
Dr. Rotimi, when you finish doing that to continue. And then if you want me to answer any question, please approve it and then I can answer. I will be here, but I will leave you to be doing the. Can you see the question?
Okay. The question that I see
Can you see the
on
question?
is yes, the one that you see on is what are the symptoms of
Okay.
mumps and its solutions. I guess you've addressed that.
Yes. Can you see the ones that are waiting to be popped up?
Okay. No.
Have to approve them. All right, no problem. Can you see the next
Okay.
question now?
Yes. One of our users said, may God bless us for the good work we are doing. May God bless all our followers too and everyone. I'm still unable to share on our various platforms. Okay, from Priscilla Ogudu. Thank you, doctor, for the good work. Please, I want to deworm my baby of 6 months old. I need prescription. Okay, if your baby just clocked 6 months, I guess there is no need to rush to deworm your baby because you have not actually started introducing series and other thing that will have brought contamination to your baby. Just give it 1 or 2 months. There is no need to rush. You know, the first 6 months, I believe you have been doing exclusive breastfeeding. I believe you have been doing exclusive breastfeeding. But if you have been one reason or the other, you are not doing that, it could be formula that you are using. I don't think there is any way, you know, the eggs of one could have contaminated. It is after the 6 months that you start the searing, you know, because it's going to involve a lot of preparation, you know, the natural fruits that are going to be processed, you know, that are going to be blended and the rest. That's when the worm can come in and just give it 1 or 2 months exercise patient. There is no need to rush to deworm your baby of 6 months. I hope that is okay. I hope you can hear clearly, Priscilla. Okay. Why I wait the next question? We're talking about deworming. It is we medics, we doctors that normally advise our parents that you can actually start deworming from 6 months upward, not when your baby just clocked 6 months. Then it can be done at 1 year, every 6 months. Then there's another question here from Samantha Shikuka. Thank you, doctors. I want to ask what causes and what can I do? My baby is swollen on the right side of his foreskin. He is 6 months old. The right side of the foreskin is swollen. Where are you talking about the frontal, the edge, or which part actually are you referring to the foreskin? Is it the frontal part of the head or the forearm? The question is not too clear. Foreskin, where we don't have a particular place in the body we call foreskin. Probably you want to say forehead or the upper arm, which exactly?
I think
But if
it's referring to the child feeding. If your child is circumcised, Samantha, you need to let us know first. Is it a circumcised child or not? And so then
okay,
you can now tell us. So I think that's
okay,
what is referring
okay, you are referring to the foreskin of the of the
to the
penis.
feeding.
Okay. Yes, normally after circumcision, especially when the plastic type is used, for the first few days, you may experience some swelling until when the plastic will come off from it. Or if your child has just been circumcised as a result of the inflammation that will happen after the circumcision, you may expect the foreskin to be swollen. So if that is happening and the baby is irritable, I will advise that you can still take the baby to the hospital for doctor to look at the child again. But at 6 months, well, I'm not sure you will have done circumcision at 6 months. Let a doctor have a second look at the child. I think that will be the best assessment for the child. At 6 months, a doctor should have a second look at the child.
Yeah. I think, Samantha, you need to send your question again. It is not clear what you meant. And you really need to tell us whether this is a circumcised child or not. So don't refer to first. Why not just tell us everything about the child because it's very unusual for just the first kid alone to be swollen. So just
Mm.
make sure they're actually giving us the correct information because that way we'll be able to so that we are sure of what information we need to give to you. So I think you need to really clarify that. Don't you hear anything said?
Yes, yes, I'm here.
Okay. We don't have any more questions apart from Priscilla, which is thanking you for the answer you provided so far. So if you're watching, drop your questions. I hope you can see us and hear us. People seem to be dropping off. I don't know whether it's because they are losing touch or what. All right. Let's see here. Welcome to the live Monday. Unfortunately, we can't connect on Instagram, so we just talk with those that are on Facebook.
Okay, maybe I will use the time just to let our mothers know probably the immunization that they have to give to their children who are less than 6 months old. The infants, the immunization that are normally given to the children, especially in the infancy period. An infant is a child that is less than 1 year. Like most of the immunizations, the vaccinations that we give are normally given when the children are less than 1 year. Starting from birth, your children are expected, your babies are expected to take 3 immunizations at birth. The OPV, that's the oral polio vaccine, the hepatitis B vaccine. All children that are born in this environment are expected to have the birth dose of hepatitis B vaccine immediately the child is born. Children are also expected to have the BCG. BCG is what protects against tuberculosis. In this environment, because tuberculosis is very endemic in our environment, it is expected that all newborns are immunized against tuberculosis with the BCG vaccine. Then after the birth dose, when the children are 6 weeks, they have their second set of vaccinations. So that means as you are going for your 6 weeks postnatal visit, you are expected to take your children along with you to the Well Infant Clinic, where they will get to be immunized against these diseases. The ones that we give at 6 months, we have the one we call pentavalent. Previously, we used to give it as DPT, but now it's pentavalent. Penta means 5, meaning that the vaccine has 5 components inside. We have the diphtheria vaccine inside. We have the pertussis vaccine inside. We have the tetanus vaccine inside the pentavalent. We have the HIV, and the HIV is Haemophilus influenza B, and we have the hepatitis B vaccine. All the 5 are given as a single dose when our children are 6 weeks old. When you are going for your follow-up visit, your children need to get this 6 weeks vaccination. Also, at the 6 weeks, pneumococcal vaccine has also been introduced in this part of the world. It's also given as part of the vaccines that our children need to take. Then at 10 weeks, the vaccines are repeated. Also, rotavirus vaccine is also part of the ones that will be given from 6 weeks upward. These are repeated at 10 weeks. The rotavirus vaccine, the pentavalent vaccine, the pneumococcal vaccine. These are repeated at 10 weeks for our children. They are also repeated at 14 weeks. You can see that they are at 1 month interval each. So we encourage all our mothers to make sure that our children take all these vaccines, because if they are taking this vaccine, they'll be protected from all these diseases. If you remember, recently, Nigeria had some part of the country experience, some outbreaks of diphtheria vaccine, but thank God, of diphtheria infection. But thank God that many of our children were already immunized. We were able to get out of the outbreak on time. We didn't get to the stage of epidemics, but because the larger percentage of our children were immunized, within a few short period, the experts were able to put the things under control. Then, like we have said, at 14 weeks, this immunization are also repeated. In this part of the world too, we give what we call vitamin supplementations. At 6 months, we are expected to take our children for the 6 months vaccination. But what we actually give at 6 months is this vitamin supplementation, vitamin A supplementation. We give it to our children in order to boost their immunities. Don't say because it's not an immunization, you are not going to go. We encourage our mothers to go for the 6 months, because the health worker also use it as a checkup. They use it to check the weight, they use it to check the height of the child, they use it to even counsel the parents on what they needed to do. Okay, Samantha is back. Samantha has just said, okay, he is not circumcised. Just notice on the right side of the penis, the skin is a bit swollen, but when changing his pads, it doesn't show any signs of pain. Okay, the very first thing I must say that in this part of the world, we have routine immunization that is normally given, that is normally done in the neonatal period, because studies have shown that the benefit of circumcising our children at the early months, early infants period, is higher if they are done at a later part. The child could be having infections around there. She could be having what you call phimosis. inability for the foreskin to retract. The infection could even happen around the foreskin. That's why I encourage you. You still need to take the child to a doctor, for a doctor to see, to assess and to see the gravity, to see the level of the swelling, whether it's something that needed urgent care. But since you say it doesn't show pain, but we don't just want to rely on that, take the child to the doctor, let the child be examined, let the child be checked. And if the child is okay, well, I will encourage you, you don't need to wait further. Get the child get the child circumcised. Because if it gets to a later period, the procedure may be too painful for the child to bear. You know, there may be need to introduce anesthesia and the rest. So it's better it is done now before the child gets out of this particular period. So that is what we encourage you to do. Routine circumcision is what you do in this part of the world, except for some children that are having some problem. Like some children, their urethra is not properly positioned, you know, what you call epispedia or hypospedia. You know, those ones are the ones that they are, they are, they are not to circumcise their children. They are to see the pediatric surgeon for intervention, except your child is having such abnormality. So we still encourage you, take the child to the hospital, get the child assessed. We also be happy to get feedback, to hear back from you. Okay, like we are talking. So like we are talking about the routine immunization. So I've just mentioned that at 6 months, there's what we call growth monitoring. And that 6 months, you know, the health workers will check the weight of the child. They'll be able to reassure the parent that this child is actually doing well, is growing well. They will check the child from the head to toes. They will check if there's any abnormality that have been missed earlier. And there is a chart that the parents are normally given in the hospital. You know, those charts, they will record the growth, the height, the weight. You know, it will be put in a graphical form to see how the child is going. From the chart alone, one could detect if that child is doing well or if the child is not doing well. So this is why we have to go for the 6 month supplementation that are normally given. They are at 9 months. At 9 months, under our national program on immunization, what we give at 9 months, we give measles vaccines, we give yellow fever vaccine, and recently the meningitis vaccine has also been introduced as part of the ones that are given at 9 months. So, you know, these are actually certain milestones in the life of infants, of our children, you know. So at that 9 months, you are expected, you know, to take the children to the hospital so that they get vaccinated against measles, against yellow fever, because these are diseases that are, you know, common in our environment. Okay, Juliet is asking, good day, doctor. Please, I want to ask, can a breastfeeding mom deworm while on exclusive breastfeeding? I also want to ask a baby of 9 weeks start eating, because I noticed my baby clips are gum on my nipple while breastfeeding her, and she sometimes brings little saliva from her mouth. Birth weight is 3 kg, and at 6 weeks, the baby is 5 kg. So your baby is actually doing well, because at almost 6 weeks, the weight is almost double. That's why we also advise our parents to engage in exclusive breastfeeding. So you can actually deworm while you are doing exclusive breastfeeding. There is no contraindication. As a mom, you can deworm, and the deworming medicine can be gotten over the counter. You can deworm when you are breastfeeding. There is no harm. There is no harm to your baby. And also, a baby of 9 weeks, 9 weeks is just 2 months plus, whether I can start eating, where baby can start having some symptoms in the gums. You know, that doesn't mean that the teeth will appear immediately. Most children will wait till 4 months before their first tooth will appear. But all these symptoms that you are mentioning, like itching in the gum or feeling uncomfortable in the gum, it could happen because that gum is, constantly engaging in working when the child is breastfeeding. So, but most children is at 4 months that we expect like the first tooth to appear, but it could happen before that time. So your child bringing saliva from the mouth, there is no harm with that. We have saliva in the mouth to help in digestion, to help as a self-cleansing for the mouth. So there is no harm in your child having saliva in the mouth. I will say that you are doing well. The weight of your child is almost getting double at 6 weeks. So keep on doing the exclusive breastfeeding. We encourage you. Don't be discouraged. Keep doing it till when your child will be 6 months. Okay, Dr. Ogbemi, I don't know whether you want to add any comments.
I think the answer you provided, the answer is fine. So I
Okay,
agree with everything you said. Yeah.
okay. So going back to the immunization that we are talking about, why we immunize our children is to give them immunity against diseases. Yeah, I'm sure you'll have heard of what we call childhood killer diseases in the early age, in the ages of our mothers, when there were a lot of deaths, where some babies at the time of Banje, the abicus, children dying, because in those early age, the science immunization is not easily at the reach of our parents. So we have a lot of deaths that normally recorded during that period. But now the immunization is readily available thanks to our government. They're also supporting at the public hospitals. We get it with the support of the government. Even in the private setting, you pay a little to have these ones that are under the national program on immunization because they are highly subsidized for our parents so that the children can be immunized. So these diseases are not as endemic or as endemic as it used to be in the past. The incidence of pneumonia is decreasing on yearly basis, on daily basis, because there are many vaccines that protect our children against pneumonia. Okay, from Rosemary Sunday. He said, hello, doctor. Good evening. God bless you for the good work. Please, how do I prevent my 3-year from having the non-regular catarrh cause the mucus is thick? We had to use augmentin to resolve it. How do we boost our immunity? Okay, your child that is 3 years old, the toddler is actually prone to infection. At that age, our children, their immunities are very low. They are just building their immunities. So any exposure to harsh weather, any exposure to infection in the air, could give them this catarrh. But what we know is that catarrh, the commonest cause of catarrh are viral diseases. And viral diseases are in the air. Some of them are self-limiting. If the child should get the catarrh within few days, the child will overcome that catarrh. But if you notice that the catarrh is persistent and is thick, like you have said, it could be infectious. Or if it gets to the stage of the child coughing, such children will need to be taken to the doctor probably for examination so that the doctor can listen to the chest to rule out what you call respiratory tract infection, because catarrh is normally one of the first few symptoms of respiratory tract infections. However, there are some catarrh that are chronic. Such catarrh need to be investigated because some children may have growth in their throats, what we call adenoids. Such children have catarrh even from their infancy period, and the catarrh keeps coming on and back. We don't subscribe to using augmentin or using any other antibiotics for catarrh. Catarrh are viral illnesses, and the antibiotics you mentioned, they are for bacterial infection, except when the doctor confirms there is a secondary bacterial infection. Probably the catarrh is very thick, the catarrh is yellow, the child is running fever, the child is coughing. It is at that stage that the doctor could be suspecting secondary bacterial infection. Doctors will even go ahead by telling you to do tests, which we call full blood counts, doctor will listen to the chest of the child to be sure there is no chest infection. But normally, if a child is having catarrh for the first time, we encourage you, give the child fluids, give the child continue exclusive breastfeeding if they are less than 6 months. Like your child that is 3 years, you can, fortify the food with vitamins, get natural vitamins. Oranges contain a lot of vitamin C to boost the immunity, or if you have the supplement, the vitamins already using at home, continue to use it. This will help to boost the immunity. But truly, most catarrh are viral and some are also reactionary. For example, if your child is exposed to dust or to an environment that is harsh, the child could also start having catarrh. So that's what we encourage our mothers not to do self medications. Thank you,
Yeah,
Rosemary.
Dr. Yeah, if I can just add a bit to that, I will say that maybe she should see the ENT doctor if the catarrh has been going on for a long time. It's happening so often, so you may want to see the ENT doctor. Like Dr. Rotimi said, if it's those kind of viral infection, we don't expect it to be happening so frequently. We don't expect it to be happening like you know um we don't expect it to be happening so frequently. So if it is happening so frequently, then we have to start looking for other possibilities, and that is when we start looking for things like adenoid and all those other things that can cause allergic rhinitis, all those things that can cause recurrent. So at that point, we want our specialist to give us a second opinion on what else could be going on. All right, all right. We got another
Okay.
question.
Yes, from another Facebook user. Good day, doctor.
A
Please, my
very
baby's eyes is pinkish and bringing out a lot of eye discharge. I took her to the hospital and the eye drop was recommended with loratadine. After using the eye drop for a week, I stopped since it has cleared. But after 2 to 3 days, I noticed the eye was pinkish and bringing out discharge again. So I started the eye drop again 4 to 5 days. I stopped since it's clear, but now I'm noticing the pinkish eyes is gradually coming back. What can I do? She was on EBF, started eating, and the rest. Well, you didn't mention the age of the child. I assume the child is still in the infancy period because you mentioned that she was formerly on exclusive breastfeeding. So if the child is in the infancy period, where you have done the right thing by first going to the hospital. So if it's red eye, or what you call pinkish eye, that is what you call conjunctivitis, inflammation of the conjunctiva. And you said it's also bringing out discharge. That means shows that redness is infectious. That's why the doctor have placed you on the eye drop, which I think is the antibiotics eye drop. But in some cases, if you notice that this thing is much or persistent, doctors could also prescribe oral antibiotic, but they normally establish that it is infectious before doing that. Yeah, you say your doctor placed the child on loratadine. So this makes me think that this child is above and is not an infant, because loratadine is normally used after the infancy period. So if your child is probably 2-3 years, or let's assume the child is a toddler because of the drug you have mentioned, the child could also be having what we call ocular allergy, whereby the child keep having the pinkish eyes on and off, but that one doesn't come with discharge. So this discharge is showing us that it could likely be infectious. So what we advise you, one thing that our mothers should learn is the power of follow-up. After the doctor have seen you, has given you the drugs, after a few days you have gotten results or you are not happy, we encourage our mothers to go back to see their doctors for the follow-up. The doctors will use that as an opportunity to review the child and probably to change the drugs or to do tests if tests have not been done before that particular point in time. So we encourage you, take the child for follow-up. Your child is likely having conjunctivitis. an infection of the conjunctiva of the eye.
Uh,
Okay,
I
you
think
may want to add, yes, Dr. Benu.
there's nothing to add to that one. I think we should just move on. But please just remember that when you're asking questions, always start with the age of the child. It is so, so crucial to every question we answer. We want you to always start with the age of your child. All right, so let's go on to the next question from Brighton.
Okay, hello,
Uh,
doctor. Why do older people encourage that baby boys wear nappies more often than diapers?
that
Okay,
seems to me
well,
like an old wife thing.
yeah,
All right,
yes,
okay.
it is like a myth. Now we have the younger generations. I think people is diapers that people use nowadays because the nappies are associated with nappy rash. You know, it harbors infection. The fact that the thing has to stay there for long exposes the child to what we call a nappy rash, or what's synonymously we also call diaper dermatitis. So we use diapers now. We don't recommend nappies because diapers you can easily discard it, dispose it. They are handy. You don't have any limitations. You don't carry infections around. Because if you use nappy and you are outside, that means you have to probably pack it in your bag, and as a result, you may get your hands contaminated. You may get the baby foods contaminated. Well, I want to believe that diapers are affordable, or if not, look for one that will be affordable. The benefit of diapers are more than nappies. These days, we don't recommend nappies, we recommend diapers. So you can also educate the older people about the benefits of diapers. Thank you,
Okay.
brethren.
Just to add that there's no difference between boys and girls when it comes to use of diapers. And for us as pediatricians, we are not really worried about what you use per se, but it's about the fact that you need to change diapers, you need to change things frequently. So some people still prefer to use the old nappies. Some people prefer, just like Dr. Rotimi said, the diaper is easier because it's disposable. You don't have to spend so much time washing nappies. And of course, when diaper is the way they do it now, most of the time the children's body are usually dry. Or even before you change them. Unlike if it is nappies, they get wet and um they kind of irritate the children's skin if you are not very alert to change them on time. Whereas for diaper, even when they are full, they have this technology to make sure that the baby skin is still dry. So so generally, I think it's easier for most parents and all that use diaper, but there's nothing special about it. Whether you're using diaper, whether you're using nappies, please remember to change it frequently. That's the key because of risks of diaper rash. And it doesn't have anything to do with whether it's a boy or a girl. I don't know what you're thinking. Maybe it has something to do with their testes. I didn't know there's nothing like that. So that is an old wives' fable. It's not from the pediatrician. All right. Okay, we got another
Uh,
question.
Good evening, doctor. My baby of 6 months has skin rashes, and the doctor told me to get Advatan cream. Is it okay? Is Advatan triple action cream? Okay, well, we try not to deal more with a trade name so that we not be marketing any brand on the platform. But if you have seen your doctor about the skin rashes and the doctor have prescribed Advatan, I don't know what Advatan is, but the cream that your doctor will prescribe will depend on type of skin rashes. We have rashes that are bacterial in origin. We have rashes that are viral in origins. And we also have rashes like heat rash that are even self-limiting that goes on their own. So, but like this triple action cream that you mentioned, we discourage it because it's is normally prescribed when one is not sure of what is happening. And as a doctor, we don't play with our children. We are sure of the diagnosis we are making. So if it's fungal, we give you an antifungal cream. or if it's bacteria, we can give antibacterial cream, or we give oral antibiotics, or if it's just an inflammatory skin disorders like some dermatitis, we can prescribe creams that will reduce the inflammation, but we don't use triple action cream. There are many in the market. We don't recommend it for our children, and we don't even encourage our mothers to buy creams like that, because the skin is meant to serve as a defense for the body. So, but when you start applying cream on that skin, the skin will lose the strength, the skin will lose the protective power that it has. So that's why we don't use a cream anyhow, unless when it is needed and when it is prescribed. Thank you.
Yeah, I agree with Dr. Rotimi. Just to say, triple action cream is not the best.
Okay.
Mm.
You are welcome, Rosemary. Yes, the last time it happened, we are asked to run tests and also visit ENT. Thank you, doctor. Okay, so that's nice. Like Dr. Gbemi suggested, the ENT. Thank God you visited the ENT. So I believe your child is safe, has been well attended to, because basically all the things have been done, tests have been done, and ENT, ear, nose, and throat doctors have also assessed the child. So you are welcome, Rosemary. So going back to the immunization that we are talking about. So the immunization is mainly meant to boost the immunity of our children, because at that age they are prone to having infections. Any exposure to dirty environment or to air that is contaminated, they could come down with any of these diseases. That's why the immunization has been put in place, and we encourage all our mothers to make sure they follow this immunization. They follow it wholly. It's actually mandatory. We can boldly say that immunization is actually mandatory for all our infants. So nobody should say he or she is not getting immunized due to one mate or the other. Immunizations are safe. We doctors have sworn oaths that whatever we are giving our patients, our children, will be something that will do them no harm. We have ethics that says principle of do no harm. So when we give vaccine, when we immunize our children, we are 100% sure we are not giving them any harm. So I want our parents to be reassured that the immunization we are giving are safe. They are totally safe for our children. They don't affect memory in any way. They don't affect their reproductive system, like the myth that people used to say.
All right, Dr. Rotimi, just let me say I'm home now. So
Okay.
I've logged into Instagram. For those who are joining on Instagram, apologies for starting so late. I was on the road, so I couldn't start on Instagram. But now I could do both Instagram and our Facebook. So Facebook and YouTube people I've been doing the ATP Live with Dr. Rosimi. So, but for those on Instagram, apologies that we were just starting so late. So, welcome. I can see those of you who are joining us, Lydia, Bisbel, Adewumi, Amaka. Thank you so much for joining us. Thank you so much for joining us, even though we're starting so late. But you still have the opportunity. We still have like 15 minutes more. So please try and ask your questions. I hope you can hear Dr. Ritim, even though you can't see him. He's here
Mm.
on the Facebook page. So feel free to ask your questions and we will try and answer them as much as we can. All right. So thank you so much for joining us. So if for Instagram people, please make your questions to start flowing quickly so that we still have time so that we can answer all of them. Thank you so much, Dr. Rotimi, for coming in and helping me out
You are welcome.
while I'm on the road. Thank you so much.
It's
I
my pleasure. You are welcome.
we don't have any question yet. And thank you, Rosemary, from joining us from all the way from YouTube. It's always nice to see people from YouTube because sometimes I do wonder whether we should maintain the YouTube live part because I don't tend to see a lot of questions from YouTube. But I'm happy to see Rosemary today. So at least to see that somebody is asking question from our YouTube channel. So that's good. Thank you so much. All right. So Brendan, please saying thank you. All right. So I don't know whether we still have questions. All right. Okay. Yes. So no question. Yeah. So Dr. Ochi, maybe you should continue with your updates. When I have,
Okay.
then I'll let you know.
Okay. Yes. For the Instagram followers, we have been talking about immunization in children, and we established that it's mandatory for our infants, meaning that by law you can't say you are not going to give your child immunization because you need that child to be protected, because that child cannot make decision at that point in time. So you need to make informed decision. Your health caregiver may also make informed decision for the child in respect of immunization for your child, so that the child could benefit and will not be, will be safe to be among other children and will not be a source of infection to other children. So we have established that immunizations are meant to boost our immunities. Because of our Instagram followers, we have established that at birth, children are given 3 immunization. All newborn babies are to be immunized with 3 vaccines. The first is hepatitis B vaccine. The birth dose must be given at birth. The oral polio vaccine in this part of the world. And we have the BCG, that's the one that protects against tuberculosis. We all know that tuberculosis is endemic in our environment, and nobody wants the family or the child to have tuberculosis. All newborn are immunized against tuberculosis. Then after birth, our parents have 6 weeks to rest, 6 weeks to bond with their baby. At 6 weeks, the mother are expected to go for what we call postnatal visit. And these 6 weeks coincide with the time the child will go for the next vaccinations. So you can see how the thing works. It's the same time that you go and see your doctor, the same 6 weeks. And even culturally, it is these 6 weeks that our nursing mothers are allowed to start going out. You can see how nature and science are working hand in hand. So at these 6 weeks, the children are expected to get the pentavalent. Penta means 5. It has the DPT, which we normally give informally, diphtheria, pertussis, tetanus, 3 vaccines, then hepatitis B vaccine, making it 4, then Haemophilus influenza vaccine, 5 in 1. But it's normally given as one shot, on the thigh of the children. So that
Dr.
is the
Ochi,
pentavalent. Yes.
Dr. Ochi, sorry, do you mind if I pause you a bit so that I can
Yes,
quickly
ma. Yes,
take
ma.
this Instagram people because of time?
Okay.
Sorry.
Yes, ma.
All right, we have a question from Zoe IBK Lawal. You say, hello, doctor. My 6 months is running temperature, and doctor gave ampiclos, vitamin C, and paracetamol. And then she's asking, she's chewing her gum. Could it be teething? Um, um, Sorry, I want to show the. Why is it okay? All right, so I got your question. So if your child is having fever and you've gotten to the hospital and the doctor have already, I believe, examined your child, make a diagnosis, and give some antibiotics. So I felt asking, could it be teething? Is a little bit how will I say it? Like it's preposterous because your doctor has already seen your child. So no doctor is going to treat your child for teething. Okay, and we've always said on ATP that fever is not due to teething. So teething is normal development. So teething does not make a child to be so sick enough that the doctor will want to prescribe antibiotics and all that. So if your child is ill, is having fever, please do not assume teething. Teething does not make a child to have high grade fever and all that. So if your child is ill, it's good. What you've done is good. You've gone to the hospital, the doctors have treated your child, so that is okay. So don't, it's not teething. Let's just put it that way. All right. So I got another question. Oluwache Yufumi B. Hello, ma'am. Please, can you talk about sepsis? All right. So talking about sepsis is a whole topic on its own. Maybe I can do that in one of the ATP hour where we normally where I just talk about a particular topic alone for the next I can just talk about it for an hour. So, because talking about sepsis is a long thing, but you can actually read about it on our website. I think we have articles about sepsis on our website, so you can read. But if you want us to talk about it, we can do that in the next how many minutes we have left on this program is a big topic on its own. But I will try and see if I can talk about it in the next episodes on my podcast or ATP Hour. Then you can always watch it and then you can learn more about sepsis. But just to say sepsis just means a child has infection. That is what it means. Children have infections, depending, and especially if it's involving multiple organs, multiple systems in the body. So we tend to use the word sepsis. So if your doctor has told you your child has sepsis, they are basically saying your child has infection in the blood. Infection, usually bacterial infection, that is the bacteria are multiplying inside the blood, and that is why she's having all those symptoms, the fever, whatever symptoms your baby may have. So that is one way to look at sepsis. Or if there are infection in more than two systems, two organs in the body, we also tend to use the word sepsis for that as well. So, but I understand what you meant about sepsis, and I will try and talk about it. So, usually sepsis are treated by the doctors anyway, and the most important thing is to get to the hospital on time when a child has sepsis, because if we don't deal with it on time, it can spread to many systems because it's going through the blood, because the bacteria is in the blood, so it's going everywhere. It can get to the brain, get to the heart, get to very vital organs, and the child will be very sick, and that child has to be treated aggressively. They can go into shock, they can go into many complications. So that's why sepsis is something important. The most important thing is that parents don't say it is teaching when a child is having sepsis, for example, and not go to the hospital, because the earlier you go to the hospital, the earlier the doctor treats your child, the better. So I hope that is helpful for all right. Instagram people are now bombarding us. Dr. Rotimi, just so done with us. Let
Okay.
me finish the Instagram. Then somebody is saying, Udi Color is saying, my 6 weeks old baby has cancer. What can I do to help her? She keeps sneezing. Okay, okay, Instagram people are just joining up because Dr. Rotimi has answered that question already. Um, most cough and catarrh in 9 weeks old or 6 weeks old are due to viruses. You don't need to do anything. Just keep breastfeeding your baby and your baby will be fine. But please make sure you are not putting all these eucalyptus oil, silver bed oil. You are not adding it to the baby's oil, because I found out that most Nigerian mothers do that routinely, and one of the effects of eucalyptus oil is that it makes the baby to sneeze a lot. So the baby may not even have catarrh, but it's those oil that is making them to sneeze.
Yeah.
So if you are doing that, get rid of that. That's number one. Number two, keep your baby away from people who have cough and catarrh. Grandparents, all the people coming to visit. If they are coughing, the siblings, they're going to school, they are coughing, they have catarrh. Please keep your baby away from them. That's number two. Number three, then you need to um, exclusively breastfeed your baby, because exclusive breastfeeding protects your baby from all these cough and catarrh, all these respiratory infections. All right. The next question: my baby is 6 months plus. His body is hot, but measuring with thermometer, I got 36.1. Should I be worried? So usually we trust the thermometer more than your hand. So if your hand is telling you baby is warm, and your thermometer, at least your thermometer is not a fake one, it is still it is functioning well. The way to know is that you can just use it on your own body and see whether it reads normal temperature, since you don't think you are hot, or use it at another child. So if the thermometer is working well and it is giving normal temperature, then it is likely the child doesn't have fever. Sometimes It's not unusual for your hands to feel warm. You are the one feeling warm, but when you touch somebody else, you think the other person is feeling warm, whereas you are the one feeling warm. So that is why I always tell mothers, your hand is not the thermometer. So we rely on an instrument. Your hand is not an instrument. Your hand can give you an idea, but the instrument is the thermometer, and that is what is going to tell us if your child truly has fever or not. Another Tiana say my ear hole has big lymph node at the back of both ears. Doctor gave us antibiotics, but it is still there. Okay, you didn't tell us how long you've used the antibiotics for. So lymph nodes are always there. They are not going to disappear, but they can get smaller or they can get bigger. So lymph nodes are normal structures present in the body. However, they get bigger when a child has infection. So, which is why your doctor gave you antibiotics. So, after a few days after the infection has been treated, the lymph node will gradually go down. It's not going to happen very quickly, but they will go back to normal size, and you can't feel them. You can't see them, but you can still feel them there. That is fine. But make sure that they are not hot, they are not painful, because if they are still hot and painful, then it is likely that your baby still has infection going on. You can always go back to your doctors for follow-up, like Dr. Rotimi was saying earlier. Whenever a doctor treats your child, and your child, whether the child gets better and it's not yet up to the what you want, or the child doesn't get better at all, the next thing to do is to go back to the doctors. So don't just say, oh, maybe the doctor doesn't know what they are doing, I'm going to go to another person. No. There's always what we call follow-up. So sometimes you going back to us will help us to know whether we need to treat the child further, or whether we just need to explain to you what is going on, or whether we need to even think of a different diagnosis. So please, if your child doesn't get better on treatments, you always have to go back to your doctors for follow-up. But like I said, the lymph nodes will go back, but they're not going to go back straight away. It may take a few weeks for them to go back, but they shouldn't be hot, they shouldn't be painful. If they are hot and painful, then the infection is still there, then you still need to go back. But make sure you complete your treatment. Some of you don't complete antibiotics treatment. You must always complete it. Even if the child is better, you must give it for the number of days. If they say 5 days, 7 days, you must give it for 10 days, you must give it for those number of days. Somebody said, what could cause malaria for a 9-week-old baby? Don't make a diagnosis of malaria by yourself, okay? If your child is having fever, that does not mean the child has malaria, okay? If you think your 9-week-old baby is hot, take the baby to the hospital. Don't assume malaria. It is a very dangerous thing to do in a 9-week-old baby, because most of us, once you have fever, you just think it's malaria, you start taking anti-malaria. That is a very dangerous thing to do, because there are many causes of fever, and in a baby especially, there are very serious causes of fever, like the sepsis I mentioned earlier. So if you think it's malaria, you just loaded them with anti-malaria. Children can go quickly because they don't have much reserve. So please don't joke around with babies. Don't self-medicate them. Don't self-diagnose them. Even if your child does look as if the child is not looking okay, take them to the hospital. I meant what I said. Really, for newborn babies less than 2 months old, even if they just look funny, even if they just refuse to suck, even if they just have mild fever, if their body is hot, they are vomiting, take them to the hospital. Don't ever make a diagnosis of anything in those babies.
I guess Dr. Gbemi's internet went off.
Sorry, Dr. Rotimi. I think my
Okay.
my
Internet
phone,
went, or I guess as
yeah,
much.
and my I think my internet, my phone, my laptop has died as well. Anyway, it is
Okay.
time anyway.
Okay.
So just let
So
us say goodbye.
sorry
Thank you
about
so
that.
much. Yeah.
Okay. Okay. Thank you everyone for following us. I want to encourage all our members every Monday, 6 p.m. Meet Dr. Gbemi on ATP Live. Thank you.
Thank you so much, Dr. Rotimi. And hopefully we will have Dr.
You are
Rotimi more
welcome,
also
ma'am.
for your ATP family one as well, hopefully. Thank you so much, everyone. We apologize for all the
Uh,
break here and there. It's a busy day.
Thank you,
I
ma'am.
just managed to make it today. Thank you so much. Have a wonderful week. Bye.